what are some of the health issues that the coronavirus pandemic has either brought to light or exacerbated in the region? And I'll just start at the top of the list, on my list anyway. Dr. Bigham, could you start us off?
Oh, great. Yeah, I get to kick this off. Now, I will, again, thanks for the invitation to participate. I think most of us are aware that uniquely for coronavirus, children have been comparatively spared compared to our adult patients in the community. They've not been fully spared in the sense that certainly we are seeing coronavirus illness, and certainly we're seeing coronavirus patients admitted to the hospital, and there is a complication of this multi-system inflammatory syndrome in children that is actually really quite significant. And we're seeing some of those as some of our sickest patients in our ICUs. That being said, I think the things that have struck me around the care of children is, number one, is that most children have adults that look after them. And so all of the things that are impacting the adults in our families and our communities are directly impacting our children as well. And that, I think, maybe one of the most profound observations is the interdependence and maybe the partnerships that I've been so impressed by between public health and the school systems. Akron Children's Hospital has a really profound presence in so many of our school districts providing school health services. And it's really been impressive for me to see how nimble the public health community has been in support of the schools, who have been, sort of leading up to this, really in desperate need of guidance. And I've just been very impressed by the public health support of those schools. And so I think that's one observation. And the second observation, which I'm sure everybody would echo, is the bright light that has been shown on issues related to health disparity and the absence of a really profound health equity. This has been something that's been a priority of Akron Children's Hospital long before the COVID pandemic. But I think, in an effort to eliminate health disparities and to really achieve full health equity for our pediatric patient population, we recognize that that's not any single hospital or any single practice working independently. That's got to be built on partnerships with community nonprofits, partnerships with public health, partnerships with schools. And so we are really enthusiastic about the fact that there is, we think, a brighter light and a little more direction, a little more urgency provided towards solutions around health equity. And we're really excited to partner on work in those areas. I have other thoughts, but I certainly think those are two key observations.
I wanted to talk about health disparities, especially here in the city of Youngstown. We have seen it really in our minority population, and just knowing people in our community and talking with them. There are a lot of people that have lost many lives. We have seen just recently, our own former council person, Artis Gillum, who lost his life to COVID-19. And so we are lucky here to have our Office of Minority Health, and that we have been working with our patients and our residents to try to get into the neighborhoods. And that's why when we started our working for testing, we went into all the communities. So each side of town, we would try to get to each week. So that people that lived in those neighborhoods could come and be tested, as opposed to, having to go and get in a car or get on the bus and get to somewhere. So I think that's how we've been really tackling that issue at our health department. And then we really have been leaning on, again, our local office. And as we're moving into the vaccinations, a lot of our population is nervous and worried and concerned. So we want to be able to tackle that issue coming up here with our local Office of Minority Health.
One of the things that I have learned throughout this public health emergency, and sort of building upon the comments of the previous two, is related to health disparity and a relative lack of trust in certain pockets in our community for health authorities, for public health officials, for government officials. And a big challenge that I've been trying to understand is how can we collectively as a community reestablish and gain trust, particularly of disaffected communities and groups. I think in order for us to succeed in the mitigation and for us to succeed in the vaccination campaigns related to COVID-19, it's essential that we earn trust.
I think that as I think through really what we've learned, what I've learned from this and what's come out of this is truly a wonderful partnership between health systems and public health. We had it before, but I think it's only been doubled down on that. So working with health commissioners and multiple different areas of cities and counties, and also health systems working together very openly about what we're doing to share on information concerning COVID-19 and our present state. And then I also think it did shed a light on public health and the importance of that. We've always had it. It's always been in the background. It's always done vaccines and inspections of restaurants and landfills. We've always had that, but I think this has raised the public perception of what public health is and the importance of that. And I think that won't go away.
I would say probably what's the issues that have come to us, that have exacerbated here in our county have been the attention to the rural community, in which we have a lot of folks that are isolated, that were generationally affected by poverty. Those issues really surfaced for us because as the pandemic evolved, we saw the economic disparities. And so a lot of our folks wrestled with many issues related to the impact economically. Initially, we saw a lot of that. And then obviously the access to healthcare in a rural community. We have access points, but with barriers like transportation, insurance coverage, and those kinds of barriers, it made it very difficult for some of our rural community that lives in poverty. So the economic impact, and then with our seniors, we had to deal with the isolation issue, and so there's an entire component of this under the health disparities. If we look at our seniors, the isolation and the mental health impact that had, not just on the senior themselves, but because of the culture here in Columbiana County, where we have sometimes multi-generational homes or multi-generational families that rely on one another as part of their network to get through things like emergencies and crises like these, that the impact to those seniors and the mental health impact to those seniors translated into other impacts into the rest of the family, including much of what we heard of earlier about the children. And so that translated into a lot of stress in the home, both economically as well as emotionally. And so those were some things that really came to light for us.
It's the importance of making sure that relationships are built within the community. We knew that when this pandemic started, there was going to be a huge, heavy lift from public health. But we knew with our health systems and with kind of how we're set up from previous, what we call emergency response preparedness, the relationships that we've built over the years, and I believe since 2002, public health has been practicing what we call preparedness activities to address issues such as when a large pandemic hits. And having those relationships, at least in Mahoning County, was a relationship with our EMA director, with Youngstown City Health Department, with our other health partners. I mean, there was many times that us as a health department, we've been on the phone with either Columbiana, Trumbull County, Youngstown City, and not only working through other health departments, but everybody almost came to our side, whether it was our county commissioners, fire and police, everybody wanted to help. And then going back to our school systems, this was something new that was for the schools, and for them to actually take direction and build a relationship with public health proved, as schools were starting to get back in place, that they wanted to listen to public health, build a relationship, and ensure that our kids were going back, not only to ensure safe instruction, but to ensure that if there was a case, that it wasn't going to be brought back into the family homes.
So I'll try to kind of pull everything together because that's really how the Healthy Community Partnership operates. So we are, for those of you who may be hearing about us for the first time, so we're supported through the Community Foundation, specifically their health-focused funds that are held there. And the purpose of the Healthy Community Partnership is to pull together partners and stakeholders from all sorts of different sectors and backgrounds for a shared mission to improve health and health equity and well-being in the Mahoning Valley. Specifically, we're focused in Mahoning and Trumbull counties. Hopefully, we'll be able to expand to be, the greater Mahoning Valley. But for me, it's been very similar to the comments that have already been made. And very early on, when in the pandemic, we saw things that we have known for a while really come to light. Certainly, health disparities. And also thinking about health and understanding that, yes, of course, especially now, we need to really bolster and support public health in our health systems, but also recognizing those social and environmental factors that impact health. So access to food, and especially with the pandemic and, so many indoor spaces, in March and April having shut down, more and more people went outside. And so there's been a lot of, national conversation and certainly locally as well about the need for investment and infrastructure to make sure that folks have a welcoming outdoor space near to them so that they can be outside, they can be physically active. And in addition to the physical activity benefits, many have mentioned mental health being a significant concern throughout the pandemic. And certainly there's mental health benefits for being outside in fresh air. And in some, cases, guidance is saying outdoors is certainly safer when practicing physical distancing and wearing masks than indoors. So it's an opportunity, potentially to see other people in a way that keeps everybody safe. So we really try to use our biggest asset for the partnership, which is our network and our relationships, to help support our individual partners in the efforts that they have been doing. Certainly wanting to help at least through our networks of communication to share information coming from our public health and healthcare partners to make sure that important information is getting out there. There have been some opportunities to think about policy change that came out about all of this. So how can we, as an example, take advantage of the pilot program in Ohio to allow SNAP recipients to use their benefits to order groceries online. There's a small number of retailers that are allowing this. How are we potentially able to make that more permanent so that more individuals more frequently and longer term are able to use those benefits to make sure that food access is not something that folks continue to have to work through. We know that that's been an issue in the Valley before the pandemic, and certainly the pandemic and COVID-19 has, as many said, shown a light on some of those disparities and issues. So we've really been trying to pull together our resources, support our partners in addressing those social determinants of health and making the case for some longer term changes to allow for some of the improvements and partnerships that have been created now to continue into the future.
And you bring up a very interesting point, and a very important point is that idea of social determinants. Regarding population health, and at this point, I kind of want to open up the floor just to kind of get the conversation going. So please feel free to riff off of each other. Regarding social determinants, public health infrastructure, accessibility, these are some very common things that everyone said that has been recognized. So from your perspective, what is the public health community doing, or what does the public health community need to start doing to address some of these issues, particularly when we're talking about access to health and equity? And I'll open it up to whoever wants to jump in.
Jeremy, as we think about public health, we think about social determinants of health, and we think about population health, all related, we get all separate, but so tightly tied together. And truly the social determinants of health truly tie all these pieces in. From a medical group standpoint, from a hospital system standpoint, population health is the new buzzword of from 2015 on, and it's going to be the reality that is set in of how we're handling patients moving forward. So population health essentially is how we take care for the community, meaning overall better care of diabetes, high blood pressure, pneumonia vaccines, colonoscopy, mammograms, those type of things. That's population health. And it's easy to say. Everyone needs to have a colonoscopy. Everyone needs to have a mammogram. But the social determinants of health, what is the education on the need for that? What is the access to transportation to get there? What is the access to actually getting the test done because of a cost issue? Or, is telehealth available when someone doesn't have transport? All of those pieces are part of the social determinants of health. And I think that is probably one of the most important public health issues right now out there. We talk about racism as a public health emergency. That does cause people to not get tests done because of issues. And the cost of payment does not allow people to get tests done. And so that does affect the health of the community. It affects the population's health. And I think that's probably one of the most important issues that I think health systems and health departments need to focus on as we enter into 2021.
We talk a lot about providing excellent care for the patients that are in our primary care practices or in our hospitals, but true health, and again, our lens is really around child health. True child health is continued health regardless of where the children are, again, in their communities, in their schools, or whether they're in front of us. And we know that way more of their child health is influenced by things outside of the walls of Akron Children's Hospital than inside of the walls at Akron Children's Hospital. And so I think maybe, again, just to reinforce what I think is critical to advancing child health or all health is there are many instances where patients are in front of us, but we're still not able to influence their overall health because of social determinants and other reasons. And so we're doing screening and detection of some of those social determinants of health. But I think to the extent that the public health system is able to do the same, it feels really important that we're able to merge or meld those barriers, their social determinants, as we detect and learn of them, and similarly work in tandem to mitigate those social determinants of health or those barriers to overall health. Because if Akron Children's detects some of these social determinants of health, we're working hard to get people plugged into community resources, but we're not seeing all of those patients in front of us at all times. So there's got to be complementary mechanisms to improve detection of some of those barriers. And I think these are critical steps to improving health equity for sure.
Some of the social determinants of health, at least we've identified, we think one of the biggest tools that we can use to overcome that and utilize some of the telehealth and communicate some of this universal messaging of addressing chronic diseases is really internet accessibility. We live in a modern era, and we think that most people have access to internet. We have a large part of our population here in the county that don't have access to that internet capability to communicate the message, or telehealth, which then makes those issues of transportation and childcare and economic barriers even worse. And so with internet accessibility, we can not just improve the health side, but we can also then impact education as we start to deal with some of these remote learning options. And so for us, we see one of the big pieces that we think to help overcome many of those barriers is internet accessibility, to then provide the access to both information as well as a telehealth option in addition to education.
And what specifically can the healthcare communities do, whether it's from the health departments or the providers? What are some of the steps that can be taken to start filling some of these gaps?
We've been involved, myself and Ryan at the Mahoning County Public Health, as well as Mercy Health, in our infant mortality. And we've been working on that since 2012. And also, Akron Children's Hospital. And, for years, we really just, when we first came together, Ohio had the worst case of infant mortality for Black infant mortality. So a Black baby born in Ohio had the worst chance of surviving to their first birthday than anywhere else in the country. So we woke up, in 2012 and been working together. And we have had some wonderful programs through Akron Children's, Mercy Health, the health departments. You know, we were seeing things change, but we were seeing a decrease in our white infant mortality. But unfortunately, we were still seeing an increase in our Black infant mortality. So we're like, how could this be? We're doing all these programs, we're reaching the people, right? That's what, or so we thought. So about 2018, and really coming together with all the health departments, you know, we've decided that we're going to continue on these great programs, but we really need to shift our focus onto social determinants of health. So in really talking to the community and what the people needed, the number one thing came up with food access, which Sarah, you know, has talked about, and I think is tackling with the healthy community partnership, transportation, and then the housing. And so I think about right now, like with transportation, it's wonderful. I just saw this morning, WRTA has, you know, shifted to June 2021 for free transportation. They have been wonderful throughout this whole, you know, COVID-19. So people can get, you know, transportation now till 2021. But, you know, think about the people that before that needed to get to their, you know, their doctor's offices and their things that wasn't happening. So we still need to work on that issue. And then housing, I always say, like, how can a mom worry about getting to the doctor and making sure she's taking her prenatal vitamins and, you know, getting all her appointments when she's worried about where she's, you know, putting her head down at night because she's living in, you know, deplorable conditions, or she can't make the rent, you know. So these are all things that we have shifted our focus to now. And I think by the leadership of our local public health and working with our hospital systems, you know, we're hoping to see a difference in that, because we just cannot continue down this path where our Black babies are dying 3 to 4 times at a higher rate than our white babies.
So one of the things that I've been actually trying to incorporate into our practices at the community health center is when we were in medical school, we were asked, you know, what is the chief complaint, and would begin the interaction by, what's the matter? And instead, in order to try to incorporate and understand and address social determinants of health, we're beginning to instead ask what matters. Because although managing a hemoglobin A1C or making sure that a person's cholesterol is well controlled may be relatively important for us, what really matters to the person who's in front of us may be, I don't know where I'm going to sleep tonight, or I don't know how many more meals I'm going to have before I run out of food. And so recognizing that the chief complaint may be really something very different, an agenda item that's very different than we may have. And then to capitalize on what Sarah had said, I think accepting, acknowledging, and hearing what matters and following through on that, and making a referral and a resource to agencies like the Buell Regional Health Foundation here in Mercer County, or the Community Action Partnership in Mahoning County, to connect individuals to the resources to try to address those needs. There's nothing more frustrating than realizing that someone is having a social determinant concern and not being able to address it. And I think collectively, having organizations like the Community Action Partnership and the Buell Regional Health Foundation to be the glue to bring these resources together, we're very fortunate in our community to have those types of programs.
I think that the other thing we've seen throughout, you know, the course of this year is one, you know, the spotlight being shown on social determinants and health disparities, and specifically how racism, you know, is impacting health outcomes. And we've also then seen a lot of communities coming together to recognize and declare racism as a public health crisis. And we've seen, the shift in way people are thinking about, trying to solve these large systemic problems with, programmatic solutions. And now we are seeing more communities thinking about how can we use, policy as another, tool in the toolbox, not to replace, programs. We absolutely still need those. But how can we think about using the stories and using, success stories, but also the challenges that come through, these kinds of programs to make the case to decision makers about, how and why some, policies may need to be adapted or changed, or better enforced, and how we may want to think about where resources are going, and how certain programs and certain organizations or certain institutions like public health and healthcare, may need more resources to address these kinds of things, because these are huge problems and no one organization is able to truly address them in the way that they need to be addressed to reach the thousands of people that are impacted. So how can we use the stories that you are seeing and experiencing in your programs, or as you're talking to people, in the food distribution efforts, or in the testing lines? How can you collect and use these stories to really communicate the need of the community and the resources that it would take to truly make a difference to those who have the opportunity to make those decisions and get resources into the counties and communities that we are serving here?
So what type of policies then need to be changed? And I'll open that up to everyone. How can these issues be resolved from a policy perspective?
Follow the money. We have been historically paid for, fee for service. We've been rewarded for, procedures and high-tech, diagnostic equipment, et cetera, and relatively speaking, reimbursement and money for preventive health and public health has really been much less significant than the high-tech, high-end things that we do in care. And so I think one of the things that I'm looking forward to as we sort of pull out of the global health pandemic is what can we do differently from a public health reimbursement standpoint to invest in the programs and the initiatives to improve the health of our community, and not rely on sort of high-tech, high-end glitzy things, but where could the money be spent that we would get a better return on our investment?
As health systems get paid and as primary care physicians get paid, there's an old way and a new way, and we're in the middle right now. The old way was you were paid the more patients you would see, the more payment you would receive, either from Medicare, Medicaid, or private insurance. The future way is you're paid on quality payments based on outcomes. And those outcomes are not just, is your diabetes under control, but did you get your colonoscopy done? How can I help you get your colonoscopy done? How can I help you get better diet and exercise, for example? Right now, we're in the middle. We still have volume payments. And that, in fact, that's the majority of it still. It's maybe 75% of our money still comes from volume. But we do have a small chunk, a quarter or so, and those numbers are off a little bit, of money that comes in for quality payments and outcome payments. And we know that's changing over time. So as primary care physicians, as health systems get paid more for quality and outcomes, they will be investing along with the public health departments and the government in programs and individual patient scenarios that will help them have better outcomes and reduce their social determinant disparities.
If patients are in the community getting good nutrition, getting good education, they're safe, they have safe spaces to be, that's all critical to that child's health. And health systems, whether it be public health or whether it be, healthcare networks, should be as supportive and as strongly advocating for that, which we always have been. None of us have worked against that, but it definitely hasn't been tied to any level of reimbursement. And I think all of our organizations, whether it be public or private, have spent countless unreimbursed investments in health and wellness in our patients and our communities. I just see those going up exponentially as the reimbursement follows. So I think Dr. Garrow and Dr. Kravec, I think both your comments are right on, and it's not against. It's not as though anybody's been working against that, but it's the pace and the sort of fervency that we're going to pursue child health as the alignments become more sensible, quite frankly, more sensibly aligned with health and wellness in our communities.
Yeah, 2 points on that, Jeremy, if I could follow up on that. Certainly one is the economic side. And as we start to move to this newer model that Dr. Kravec talked about, it makes it difficult to look at and consider the investment that we would need to make into public health and some of these other mechanisms to improve overall community health through addressing chronic disease. You know, we recognize that the impact of chronic disease has had on populations that have been adversely affected by, disproportionately affected by coronavirus. And so the whole investment into the healthcare system, both direct patient care as well as the larger community and population health efforts need to be understood. And then my second point would be, as far as policy goes, we need to look at policy development in nearly every sector, because we know that the coronavirus response has really opened our eyes to see that public health is a continuum. I mean, we all have a role in public health, from the individual resident to the corporate citizen, right? And the healthcare center of that system, as well as our other partners that I think Ryan spoke of, this continuum of partners and participation that we see in the response for coronavirus makes us recognize that health needs to be incorporated into all sectors of all the things that we do. So in all policy development, be it transportation or healthcare system or construction, green space, parks, exercise, all those pieces, we need to consider and look at all of that policy development through a lens of health, so that when there's opportunity to infuse a health option or to improve a community health issue, we can incorporate that into all policy development. And I think that further, it adds further importance to the relationship between legislation and policymakers to the healthcare system. So I think that needs to be incorporated as we go forward.
One thing I'd like to touch on real quick is so this idea of awareness among the communities, as far as educating them on preventive health measures, that sort of thing. Tying it into something that both Aaron and George had sort of touched on before, this nervousness, specifically over the coronavirus vaccine, or just overall maybe a lack of trust in certain populations, particularly the inner city populations. Ryan, from your perspective, how can the health district or the greater healthcare community sort of bridge that communication gap with some of the inner city populations to help build that trust, so we could start pushing that message of prevention?
There's a lot of opportunities here that a health department can do. One is we have what we call PIO teams. So we ensure that we're getting correct, positive messaging out to the public. But when we start to look in some of our urban areas, what these individuals need to have is truly trust, and ensuring that individuals that are delivering the message look like them. So when we look at people of color, we need to ensure that the ones that are going into the community to address these health issues and to educate them are truly coming from individuals that they can relate with. And we've had a model here through Mahoning County Public Health through our Pathways Hub program, where we use community health workers. And these community health workers are individuals throughout the community that can go out and work with individuals and educate those individuals at a level that they would understand. So that's the model that we can look at here from at least Mahoning County Public Health.
Something that we have found very helpful here. Since the very beginning of the pandemic, Mayor Brown in the city has worked with local churches, and we were meeting weekly actually on Thursdays, and we would just talk kind of about the pandemic, what was happening. This was when, a lot of the clergy wanted to know, should we keep our, churches open? What can we do? So I kind of was that sounding board for them. And we just would talk about things, and then we would spend like the next 20 minutes in prayer and just praying for, the community and everyone else that was really, knee deep in this during the pandemic. So, as things went on, we started meeting every other week. And so I was able to build that relationship with them, so that when we wanted to do testing, in the community, they were open to say like, hey, come have it at our church, and you could have it here at our church. They were real welcoming, and to, and I remember going to Reverend Harrison's church, And when we did the testing there, I'd say, oh, where did you find out about this? Oh, my pastor said, come and get it. So they were like, it was just nice that they, their pastor would talk about it, on a Zoom call, because they weren't having in-person services. So then I said, what did he like say? You're going to heaven if you don't come. And so there was a lot of, the old Black women that, didn't want to leave their house, but they came because their pastor told them to. So I think that's the approach we're going to have moving on to the vaccine. I already received a text from my very good friend, Reverend Lewis Macklin, who is on our board. He is deathly afraid of needles, but he said he would do it and, get the vaccine, on TV if he had to, or just to encourage, his congregation to get it. So I think using those faith leaders will be very important, and really talking to it because, in myself, just in growing up in the church, you do trust your priests and your pastors and whatnot. So I think we'll use that approach for a little bit of ways to kind of build that trust with people. So that's kind of what we're trying to do here in Youngstown.
We're on a network of folks representing different organizations throughout the state of Ohio, and the in the neighborhood approach for the testing was something that a lot of folks said, oh, wow, that's really incredible. So like the going to where people are in places that they are familiar, that they are comfortable in, with, faces and people that they trust is so critically important. And I just wanted to lift that up because I think that building those, deep, connected, non-transactional relationships is so important, and that takes time. And it means, showing up and being there, not when you need something from someone, but when you want to just show that you care. And at, the Healthy Community Partnership, we certainly want to show and evaluate our success in terms of, what kinds of outcomes are we producing, but we also at the same time value and put a lot of importance on how we work together. Because the way that we are, interacting and building relationships with each other has a direct impact and correlation to the kinds of outcomes that we are going to see. So I just wanted to lift that up, that is something that is, truly wonderful to see, and it's happening here. And it's something that others across the state of Ohio took notice that, this is the way that this needs to happen if we're going to see the kind of results and the success to improve the health of folks in the way that we need to.
Are there any improvements that need to happen as far as infrastructure is concerned? Earlier this year, we saw the Youngstown City School District, for instance, open up clinics in their schools to work with residents of need. Does that open the door to maybe opening up additional clinics throughout, or is that even a possibility? I guess just, how could we address any infrastructure issues that might exist?
I think one of the areas that I'd like to talk about is that really on access, Jeremy, is focusing in on the telehealth that we have available. I do know, and I think Wes brought this up earlier about the internet is a very challenging part, but for those that do have access to the internet, that is something that does expand, the telehealth does expand capabilities of care to people, even if they're not able to leave their house. As Aaron Bishop just mentioned about people not wanting to leave, they were still able to see a primary care doctor or a specialist. So I think in the past, telehealth wasn't embraced by doctors, patients, or insurance companies and the government payers. Now it's embraced by all three, at least during this pandemic. So we'll see what the future holds, at least from the insurance company. I think the patients and doctors have gotten over their fear or dislike of it. That's part of what we do now. We're seeing on a given week between 10 and 25% of our patients virtually, which is amazing. It's positive. It really, as we have clinics and schools, as we have vans that go out. Mercy has vans both for dental health, medical health, and mammography that go out to the community. That it just expands access. We have centering pregnancy programs that are out in the communities, and primary care offices that are out in the communities. I think that is the key to access, and every person should have a medical home, a primary care doctor, where he or she gets their care by a doctor, a nurse practitioner, a physician assistant. They need to be seen, every single person have a primary care home, and then have access.
Talking about partnerships, everyone's mentioned partnerships throughout this conversation. What about the business community? What role can the business community play in all of this?
Because a very important one, but it's certainly one that the Healthy Community Partnership has recognized as a critical voice that we need to have, but wanting to make sure that we are approaching the business community in a way that connects and makes it clear to them, how businesses impact health. And that can be there's a lot of different ways, I think, to, have that discussion. But, specifically, one of our focus areas is, talking about active transportation, which includes public transportation. And as has been mentioned, I think Aaron mentioned, WRTA has extended their free fares into next June. But we've also seen a significant expansion of WRTA service into Trumbull County. And that allows, more folks to get to more places. So more individuals are able to get to jobs, grocery stores, medical appointments, certainly all of these critical destinations. So, having that conversation about, transportation has an impact on health. Transportation also has an impact on business. How can, business leaders who see and understand, expanded transportation benefiting them also help us, have the same kind of conversation about making sure that transportation is well funded and supported, so that we are also then serving the same individuals to make sure they're able to get to the doctor's office or get to the grocery store or get to wherever it is that they're going. So it's the same, topic of conversation, which is expanded transportation access, but having it in a way that makes it clear that this one goal has a lot of different implications for different stakeholders, but everybody stands to benefit.
I think what's changed, as we hopefully, and we are rolling out of the COVID-19 pandemic with the vaccine implementation. The question will arise all the time: well, what is the new normal? When we go back to normal, and what is the new normal? And I think one of the things that will not go back to normal, and this affects the business community, is how businesses deal with their employees who might be sick, who have sniffles, who have a slight fever. I mean, I know in the past, and this is probably true for healthcare and other businesses, if someone had a cold or a fever, they would maybe take medicine and still come to work. And maybe some business HR practices didn't allow for time off as much, or if their kids are off, people would give them or would send them to school sick. I mean, that happened before. I think there's going to be an increased sense of community that we don't do that. I think businesses play a big part in that as we think through that with their HR practices, encouraging workers to be able to work from home still in the future if that's a possibility for them, or take time off without having penalties. I think that is no matter what, even if it's a common cold or influenza or COVID or whatever it is, I think that is something that the business community has a part in moving forward, both locally and statewide and nationally.
We have a greater understanding of that continuum between economy, education, and health. If you draw that in a big circle, and I think we better understand the role of business and economy in this COVID response. But I think an important piece to that is that businesses have a greater understanding of their role in that as well. And so we in public health, we've been very successful here in Columbiana County. Our businesses have been fantastic. They've been there to help us, and we've had a great exchange of information. And so I think public health has moved, at least in this response, we've moved to a position of talking with businesses instead of talking at businesses. Historically, we've been a regulatory piece to businesses, be it septics or wells or food or all these other mechanisms, campgrounds, you name it, landfills. We've been the regulator and overseeing businesses. And so we've now moved to a new position of working with businesses. And so that partnership has really evolved, I think, through this coronavirus response. And hopefully that's something that'll move forward, and that businesses will understand that if they keep their workforce healthy, and we're part of that equation, if we can help them keep their workforce healthy, they're going to be more successful. They're going to generate revenue, which then is better to create jobs and create opportunity for the community and continue that circle of health, economy, and education.
This is the first time that businesses call us, and ask us for our advice and how can we keep our employees healthy. And then we found that certain businesses were putting things together that, like, hey, we want to show you this model that way, they were being creative and ways to keep their employees healthy. And then we'd go to the next business and kind of give them. So it was just really nice that, they included us. And I think now, we still are getting calls from them, like, what more can we do? Do you have some, more information out there? So it really has been, because I think that was always missing because it's always anytime we're on a coalition, got to get businesses involved. And now I think we have this relationship with some of our businesses that I know moving forward, I can go to them and say, hey, we're working on this now, and you did a great job during this. Can you help us out? So I think it really has strengthened our relationship with our local businesses.
It's really that trust factor that I think we're talking about with our public health and health systems, in building trust and relationships with the community. I sort of feel like that's been strengthened also between public health and our business community. And I think, again, I think none of us want necessarily diametrically different things. I think we all want health and wellness in our communities. It was sometimes coming at it from diametrically different perspectives. And I think there's much more alignment, which is, I think, a real testament to perhaps the way we're going to pull through this in a far better way than maybe we were coming into this pandemic. And for me, that's really a positive impact amongst all of the terribleness that we've experienced. It's really a positive, hopefully, outcome.
We in our office, we've looked at it and said, COVID-19 has made our community stronger. And it's hard to look at it from that perspective, but it has. It's made our community stronger, both locally as well as regionally. We rely on our health partners. We rely on our business partners. We rely on a very large, broad spectrum of individuals and businesses and partnerships and organizations. And I think that's really, we talk about crisis. You get through something that's really hard. When you come out the other side, you're a stronger family, you're a stronger person. And I think that coronavirus has done that to our community, both narrow as well as broad. We are stronger. I think we will be much stronger coming out of coronavirus because of these relationships.
Perfect segue into my last question, Wes. We got about 5 minutes, so if anyone wants to comment, just give me a couple second rapid fire answer. But where do we stand right now? What are your projections for the first quarter of 2021 regarding COVID-19?
Continue social distancing, mask wearing, staying home when we're sick. Those are all as important now, and even through Christmas as they have been over the past year.
We know in public health that vaccinations are critical to illness prevention, and the flu vaccine, there's really good data that one flu vaccine for every 5 patients that get a flu vaccine, one of them is prevented an influenza illness. I mean, that's big, compelling data. And I don't think we have the track record and won't have the track record for some time, whether or not the COVID-19 vaccine has even a more profound effect or not. But I don't think that we can take a wait and see approach. That's unsafe. The health of our community is too fragile at this time with the prevalence of COVID-19 disease. And so I think a very reliable rollout of the COVID-19 vaccine is going to be critical to the sort of the maintenance and strengthening of our healthcare systems and our public health infrastructure, but even beyond that, our communities. And I think it's critical. And so I can't echo more loudly your comments, James.
We're already seeing obviously a massive surge, in the number of cases and patients requiring resources of the hospitals, the intensive care units, the emergency rooms. And, one of the things that I hope to see in the first quarter of 2021 is that we are all good neighbors and good stewards of the resources in our community, and that we really come together to do the public health 101 measures, wear your mask, wash your hands, avoid large crowds, socially distance, because we need to try to reserve those resources in the hospital, in the intensive care unit, for people that really need it. And anything that we could do as good neighbors to, allow our brothers and sisters who are working on the inpatient units and in the emergency rooms, the capacity and the space, mitigation is essential, right now. Wes mentioned, the impact on rural communities. And for a long time, early in the pandemic, this was really a sort of urban, suburban, densely populated community concern. And in the rural communities in Ohio and Pennsylvania, the virus is here and everybody's tired. But guess what? This is not political. This is clinical. We have to just hang in there, do public health 101 until, we get the vaccine, enough people in the vaccine, in the community vaccinated. Don't let down your guard.
Thanks for watching the video. Be sure to like, subscribe, and hit that little bell for notifications. And also make sure to connect with us on Twitter, Facebook, and LinkedIn. For all of your business news, visit businessjournaldaily.com. For all of your arts and entertainment news, go to afterhoursyoungstown.com.
717 Credit Union. Business services designed to meet your daily needs. Commercial loans, business deposits, merchant and payroll services. 717 Credit Union. It's knowing you were treated right every time.